up on the screen.
The what?
This.
You want?
Okay. Hi, everybody. Thank you all so much for joining us here today. So we're going to get started just a couple of minutes early. So just to begin with, a brief overview of the agenda for a pretty packed meeting that we have today. And we do have to finish by 11. That's critical criteria, as they say. So I'm going to just spend a couple of minutes with a welcome. Then we're going to hand over to our wonderful MEP host for this event, Mr. Uheli, who's from Hungary. I'm then going to present a brief overview of our 8th report on the financial impact of lung cancer. We're then going to have 3 speakers. The first is Emma Anderson to talk about the advocacy perspective. The next is Alexander Brucey, who's going to talk about the patient perspective. And lastly, then we'll have Lydia Gill, who will talk about the caregiver perspective. And time permitting, we hope to have some Q&A. And then we will close out the meeting with the summary and a call to action as well. So, to welcome you all here. It's great to be back here in person after 3 years of virtual. And thank you all so much for joining us here in person and online. We're going to have a lot of information that we're going to hear throughout the course of this meeting. And I think at the end of it, we all really will have a better appreciation of the financial toxicity of this disease. So I'd like to again thank and welcome our MEP host, Mr. Uheli, who's a member of the European Parliament and a co-chair of the MEP Lung Health Group, who's going to give us some comments on the EU perspective on lung cancer. So I'll hand over to you and thank you so much again.
Thank you so much, Anna-Marie. Good morning, ladies and gentlemen. It's my pleasure to be your host today. Early morning in the European Parliament. You have to know that as a member of the Sant Committee and also co-chair of the Lung Health Group here in the European Parliament, this is my duty to be your partner, your host. I'm not a professional. I'm Dr. István Újhely doctor, in Hungarian, Dr. Újhely István. But I'm a lawyer doctor, not a medical doctor. My parents are doctors, so I'm very close to the health issues and systems. And in the past, I worked 3 terms in the Hungarian Parliament and in the Hungarian government. And I know very well how difficult to organize, to support, to finance the public health systems in the member states, especially Eastern or Central Europe, where we have different backgrounds and past. And that's why some years ago, I was one of those colleagues here in the House who had one beautiful idea. In the time, we thought that it's only a dream. To have one European Health Union program. I'm one of the initiators. And I told to the colleagues in the European Parliament that we need partners to fight for the European health issues. It means professionals, stakeholders, associations, patient organizations, and of course, several times, the industrial partners, because they have money to fight, to make the lobby sometimes in the European bubble. You know very well the health is a member state competence. Okay, we can't touch it because for the governments, several times it's a sovereignty question issue. They don't want to give the health policy to the European institutions. It's okay, it's right. My father was a family doctor. I know very well, it's very far from Brussels to organize the local service, health service. It's a member state competence. But I really believe that we need stronger European networks and policy programs for our health. I think if we need a healthier European society, then we need stronger political actions, tools, frameworks on European level. My colleagues wrote me a long speech about the lung cancer, but I think you are more familiar with the topic than me, so I will not start to read you all those details, what you know very well and better than me. But it's very serious to read that globally in 2020, there were 1.8 million deaths all around the world. It's a global data. It's very hard. This is one of the biggest enemy for us. And you also have to know that my family background, I have 6 kids. And as a father, and all of you, I'm always very nervous about the present and the future. As a political decision maker, I know very well you and the professionals need better and stronger lobby and partnership programs locally in the member states and also on European level. That's why the last years we had lots of fights. This is the first time when we could establish one own committee in the European Parliament. Okay, you can ask me, why is it important? Come on, one more committee, you will have so many speeches and nothing results. It's not true, because in the European Parliament, when we can ask the 700 MEPs to give stronger presence here in the Parliament for the health issues, it's a result, because it means we will have a bigger and bigger lobby in the House. And why do we need lobby? For example, because of the decisions about the budget. Without strong and good budget for the House, we will have only plans and reports, but we will not have enough money and tools to support those professionals who would like to fight against, for example, the lung cancer. And now this is the first budget term, budget framework term, when we have one bigger budget for the European health programs. It wasn't easy because we have so many other lobby here in the House, agriculture, industrial lobbies. You know how does it work. The same like at home in a town or on national level. But we could create the EU for Health budget, which is bigger, not enough. It's a peanuts, but it's bigger than at the time before. And in the or from the EU for Health budget, we can support actions. For example, under the European Cancer Plan program. So this is my duty to be here. And I really would like to ask you to push on national level and also on European level your report and all your your idea. When Marta contacted to my office, Zoltán, to be your host, we immediately answered yes, because for me and for my colleagues, very important to have the direct line to you. It's not about the votes on the next election. I will not run again. For me, it's everything is a volunteer, not without any kinds of political aims to organize these kinds of events and networks. But I hope that we can be friends and fighters against the cancer, against the lung cancer and of course other cancers the next years, because I try to stay here in Brussels, maybe work together with you and for you. So thank you so much, ladies and gentlemen. And one more information, it's a technical information, but for me it's very uncomfortable. You know me, when I'm a host, then always I like to be there from the beginning till the end of the events. All these kinds of events are a big lesson for me to learn. But my other job is to be vice chair of the TRAN committee, Transportation and Tourism Committee. I'm first vice chair in the committee, and they put one voting session from 10 to the TRAN committee, and as vice chair I have to be there to vote. So I'm so sorry, but I have to leave you in 10 minutes. But my colleagues will stay here, and of course I will be your partner in the parliament in the future. So thank you so much, and have a useful day for all the Europeans. Thanks.
Well, we would just like to say we really appreciate having your time here. We understand how much pressure people are under here in the Parliament with a million and other things to do. So thank you so much for being here, and thank you for your comments.
I'm sorry, may I have one more? Because I have two small kids. The smallers are 6 and 3, and I really would like to give them, but if I have one, your parents, it's impossible. So I need two to give them as a
So
gift.
there's more down the back, and Maeve is
Thank you so much. It will be at home. Thank you.
Maybe a spare one in case. You never know. Because the last thing we'd want is for you to go home and then there to be a fight over the lights when one gets one and one doesn't get one. So it's a good job that you remembered that. But to your comments, you're absolutely right. I mean, obviously, we know we face difficulties when health is an individual country competency. And the onus is really on all of us to come together, irrespective of what type of stakeholder you are. You know, by working together and coming together as a community, we can really make huge inroads in making health such a priority at the EU level, and not only health in general, but cancer. And obviously for all of us sitting here today who have a particular interest in lung cancer, it's so important to make sure lung cancer is part of that healthcare agenda and part of that priority for care as well. And we really hope now with the updated EU Council recommendations that came through, that we will see inroads into the implementation of lung cancer screening across Europe, because we know that is such a huge, important part of what we need for our community, and we all have to come together and work for that as well. So huge thank you again for being here with us. We really, really appreciate it. And we know that you have to leave us now to head to your next session. So just to say huge thanks again. So it now falls back on me to start talking a little bit about our report. So for those of you wondering, why is Anne-Marie sitting? We have to remain seated for the cameras, so that is why, in case that's a wonder or a question. So obviously, for those of you who are here in front of you, you will have the report. And as you can see, it's quite an extensive report. So really, the purposes of my presentation is to give you a bit of a broad overview of this report, because we wouldn't have time to go into every little detail that's in it. So I would ask you, when you come away from this, to read it in its entirety, because there is so much information there. So before I begin going into our report information, for most of us sitting here today, and for a lot of you who will have joined us online, this would be a familiar face. This is Mario Volsblum, who was a board member of LuCE and who sadly passed away in October of this year. So I'm going to have to read this because obviously at a board, it has been a very difficult time for us with Mario's passing, and our thoughts are always with Mario's family. Mario was a beautiful shining light in our community and was a very special part of the LuCE family, and we really miss her each and every day. She has made a lasting impact on our organisation as a whole and on our community. Mario's memory will remain. It will forever carry on through the lives she has touched. And I think we can all hold that dear to our hearts, because she was such an incredible individual. So Mario, we dedicate this to you. So for those of you who are not aware of LuCE, where have you been? But LuCE is Lung Cancer Europe, and we're a pan-umbrella organisation. And really our vision, I feel, sums up what we are trying to achieve. We want to ensure that all Europeans impacted by lung cancer will have equity in access to optimal care, so that they have the best possible outcomes and quality of life. So as you can see, that vision statement is very broad. It covers across the care pathway, but it also makes a very important point about equity and access as well, because we know that that is not a reality for a lot of people impacted by lung cancer across Europe. Our core purpose really forms around 4 key core purpose areas, and that's around representation, to represent our lung cancer community, to strengthen our community, to act for our community, and to amplify the voice of our community. And by taking these 4 core purposes together and all of the different things we do as an organisation, it's really with an end goal to improve the lives of people impacted by lung cancer. So to start off now, to go through some of the information and the data in our 8th report. So the background really to this stems from previous reports that we have done, whereby from that we had certain questions and information where it was very clear to see that there was a financial impact of this disease, and a very negative impact at that point. So whether it was looking at access to drugs or innovative therapies or clinical trials or early diagnosis or whatever it might have been, there really often was a common thread coming through that of financial impact. And then that is really what prompted us to go and get additional data to find out exactly what is going on within our community in Europe. So part of this was to understand the scope of financial toxicity and to try to understand better the repercussions of these financial difficulties as well. So the aims were quite numerous, but I really believe that when you read the report, you will see that we have achieved these aims. It was to explore the extent of financial toxicity, to understand and explore the factors relating to financial distress, to identify what the coping strategies are, and to identify any interventions that might be available or that we need to put in place to help people deal with these financial repercussions. So how did we go about this? Well, this is our 8th report, and they usually follow quite a similar methodology. It starts with an in-depth literature review, which helps to feed into the questions in our survey that goes out to our members. We then have a working group that is formed, and the working group is chaired by myself, but really led by Diego. And we have a number of people then that work together in the working group to further develop this survey and then to disseminate. So this year, the survey was disseminated in 16 languages. Don't worry, I'm not going to name them all because I will probably miss a couple of them, but it was tried to be as broad as we possibly could because we know language can be a barrier to taking part in surveys or other things that might go out. Then, of course, there was analysing all of the data after the survey came to an end. So it was live for a number of weeks earlier this year. So the data was analysed, it was put together and then written up into the report that you see here today in front of you and that you'll be able to access later online. So an awful lot of work, time and effort went into this report and a number of iterations. So huge thanks to everybody who helped and assisted in any way with that. And of course, we have a toolkit that goes with our report, and we've been working to improve the toolkit all of the time. So the toolkit comes obviously with the report, an executive summary, a number of infographics, some social media banners, and so on. And as we talked earlier this year as an organisation, we're going to further expand out that toolkit to look at country cards and individual cohorts of people with the disease, whether it's maybe oncogene-driven disease or so on. So all of those will come after in the coming weeks and months. So a brief overview of the participant demographics. So this year we had the most responses we've ever had to one of our reports, 1,161 participants, which was broken into those diagnosed with lung cancer and those caregiving for someone with lung cancer. The majority were female, so that probably comes as no surprise because in our previous reports, there was quite a lot of female representation. The majority were also in the 55 to 64 age bracket, living with stage 4 disease, so living with advanced disease, and also with non-small cell lung cancer with adenocarcinoma, the particular cancer type. From the demographics as well, there was a number of people who had an oncogene-driven cancer, and the majority in this cohort was those with an ALK-positive lung cancer tumour. There were also, the majority were between 1 to 3 years from diagnosis as well. So there was about 5 countries where we had nearly 50% of all our participants. So that was Ukraine, the UK, Spain, Greece, and I'm missing one, the Netherlands. So a lot of our responses came from those 5 countries. So when we looked initially at the baseline financial situation to see where people were before the diagnosis, the majority were really employees in full-time employment. They felt that they were in control of their financial situation and able to meet their monthly expenses. However, when we look at before and after diagnosis, and as you can see here from this figure from the report, there was quite a jump in all 3 questions asked, where nearly 40% felt that they weren't in control of their financial situation post-diagnosis. Nearly 50% felt financially stressed, which is a huge significant number. And there was nearly 30% unable to meet their monthly expenses after the diagnosis. So you can see across all 3 questions, there was quite a jump in the percentage saying that they felt financially vulnerable after the diagnosis. When we looked at issues around monetary strain, there were quite a number of key things that came out, but I'm going to draw your attention to nearly 70% experienced some form of financial difficulty. and just over 30% needed greater than 20% of their household income to pay the expenses associated with lung cancer. This is huge to think that that number of people are using such a huge portion of their income to deal with the consequences of this disease. When we looked at that in a little bit more detail in terms of what sort of costs participants experienced, we found that there were costs across medical, non-medical, and then there was also indirect issues as well. So if we look at medical, the main items were really around pharmaceutical bills and hospital bills. When we think and look at non-medical, a lot of the expenses were related to transportation, so getting to and from hospital, and also that increase in household utility bills as well. Indirect income was also significantly impacted, and you can see a spread in the percentage of the reduction of income. And when you think that almost 32%, that is a huge number, let that sink in, that had greater than 40% reduction in income due to their disease. And this was due to three key issues: unable to work, absence in work, and retirement due to illness. So there's a huge monetary strain put on people impacted by this disease. When we look at that in a little bit more detail, particularly in terms of medical expenses and things that were ranked as high and medium costs, we can see a lot of this was due to private consultations, healthcare professional services, hospital bills. All of those types of things were high and medium costs. When we look at non-medical expenses, there were so many items that came under high and medium cost, whether it was utility bills, caring for family members, overnight accommodation, and hospital parking is a huge expense for an awful lot of people, which can really impact the financial situation. When we look at items of financial distress, there was a question in the survey how difficult it was for people to live on their total household income right now. And as you can see, a significant proportion are finding it difficult or very difficult to live on their income right now because of the lung cancer diagnosis. When we look at it in terms of monthly household income that's used to pay expenses, again, we can see there's a significant portion between the 30 to 40% and those experiencing greater than 40% in terms of the percentage that they need to use in expenses related to lung cancer. So all very, very sobering facts and figures that you're getting here from this report. When we look at it in a further detail again, in terms of paying for these expenses relating to lung cancer, nearly half of the respondents had difficulties paying these expenses related to their disease. And those in a caregiving capacity reported more difficulties than those living with the disease. And again, a lot of the issues around this are things that probably come as no surprise in terms of travel, hospital, medical bill cost, healthcare expenses, and so on. There was a number of adjustments people felt that they had to make to deal with these financial repercussions, and there's a lot more information in the report itself, but this just gives some key highlights, whether it was around reducing spending on leisure activities, changing plans, reducing basic spending, but then also whether people had to maybe use savings, borrow money. And as you can see, nearly 15% of those who participated in this survey had to sell possessions to deal with the financial repercussions of this disease, which is very difficult reading for people who are in that situation. We really, really need to do more. Of course, as we are well aware, people who are experiencing financial difficulties, there is always, well, nearly always an impact on well-being. And here in our survey, there was impacts on well-being identified. So 82% considered that their financial difficulties were a barrier to treatment and care for their disease. Again, a very significant figure. A number of them also reported that at least one sphere of their life was negatively affected, and in particular, mental health was negatively impacted because of these financial difficulties. For those with or without financial difficulties, there was a number of perceptions of access barriers due to personal finances. So a lot of this revolved around access to supportive services, and we know supportive services is a really important part of the lung cancer care pathway. Access to innovative treatments and clinical trials as well. And you will find in the report itself, there is some further information on this. In terms of making decisions based on these difficulties, 26.5% made decisions that negatively affected their self-care. And this broke down into things like delaying or foregoing supportive services, declining to see a specialist, delaying foregoing treatment. So again, really difficult reading here, but this is the reality for people living with this disease. When we looked at it in a little bit greater detail, you can see that these financial difficulties had a negative impact across a number of different areas, such as concern for family, worries about not being able to pay back money borrowed, pressure to return to work, and so on. And also here in this, you can see that a significant proportion of over 40% perceived that their financial situation impacted their response to treatment, recovery, or care, either quite a bit or very much. In terms of coping with financial toxicity, a number of people approached family and friends, approached the public healthcare, and also approached public social support. And as you can see from here, irrespective of who or where they approached, quite a number of people did not receive the assistance that they needed. And we also find that quite a proportion of participants never discussed finances with their healthcare team. So a number of supports that people felt that were needed were really around medication, healthcare, transportation, parking, all of those things a lot of people might take for granted. And our last question then was really around what sort of financial supports or benefits were available. And again, here for people living with the disease and those in a caregiving capacity, there was quite a proportion who didn't know if any of these were available. So there's issues with signposting, but also there was a significant portion where there was no benefits available to either those in a caregiving capacity or those living with the disease. And here you can just see some of the comments that were made in the free text aspect of this report. So that just is some very sobering reading from this report. And here I've tried to give you a bit of a brief overview of the data that came out of this report. And I'd ask you to please, when you go away from here, to sit down and read the report in its entirety. So now it is my great pleasure to introduce our first of three speakers. Our first is Emma Andersson. Emma has been working at the Association of Cancer Patients in Finland as an advocacy specialist for over 6 years. Emma is involved in things like the HTA process and collaborates with national and international stakeholders. And Emma will talk about the advocacy perspective of the financial impact of lung cancer. So Emma, if you'd like to come here.
Thank you very much, Anne-Marie, and a very good morning to everyone. It's a pleasure to be here with you today, and I'm really happy and come with a greeting from Helsinki. And today I'm going to talk about the advocacy perspective of the financial impact of lung cancer. As Anne-Marie mentioned, I work as an advocacy specialist at the Association of Cancer Patients in Finland. Okay, these are the topics that I'm going to cover here. Talk a bit about the patient advocacy and real-world evidence, and also the burden of cancer in itself, and what it means to have financial toxicity, and how it might affect patients and caregivers. And also, I selected some issues related to financial difficulties as case examples for Finland from the work that we are doing and have been doing. First of all, a very big, huge congrats to LuCE for long-standing data collection. It's very important to have that real-world evidence and to gather information on the needs and challenges patients and caregivers face. And LuCE has been for many years doing this very important work, and let's hope that it makes a really big impact, and more people see the necessary and importance of patient organizations working in advocacy. There currently, I just took a quote from the European Commission. There are around over 12 million cancer survivors in Europe at the moment, and there are currently at least 200 known cases of or known types of cancer, and it keeps increasing with the more new emerging subtypes. So more and more survivors habit this wonderful continent. And of course, it means that there are also emerging issues, challenges that have to be tackled with and need implementation both at the European and national levels, and not forgetting the grassroots level as well. Here are a few quotes I took from the excellent LuCE survey from patients living with lung cancer from Finland. And as with all the wonderful quotes in the report, how cancer affects one, it's always the individual that has cancer. There are no cancer alike, and also the life situation, life circumstances, they're very different, and depending on the patient. And unfortunately, the financial toxicity, burden, difficulty, challenges, however we name it, it's not a European problem. It's a global problem. And here are two academic articles that touch upon the topic of financial toxicity, and one is also related to employment issues. I'm going to go before the case examples. I'm going to go over one individual case example. I had the chance of speaking with a lung cancer patient when I was preparing this presentation, and she was happy she had been collecting receipts done on Excel on all her costs related to medicines, travels, name it, and I'm just going to quickly read it. In the early years of my lung cancer, 2009 to 2012, I kept a detailed record of costs. I saved all the receipts because I was trying to receive financial support or compensation. Somehow I've always missed out on everything. The Social Insurance Institution of Finland, Kela, didn't compensate anything. In 2009 to 2012, I participated in a clinical trial and Kela didn't cover travel costs. I was forced on zero income for a year prior to the diagnosis when my health deteriorated and I couldn't work any longer. Without a diagnosis, I couldn't get sickness allowance, and as a wife of an entrepreneur, I wasn't good enough for unemployment benefits. I had to sell my apartment and live on rent to cover all my expenses. Besides travel costs, the main expense was dental care. I received chemo for 12 years and it damaged my teeth. Expensive repairs had to be done, surgery, implants, etc. You can only get those through private dental healthcare. And here from the same person are then the calculations she did. And just to briefly mention that the Social Insurance Institution of Finland does cover some costs, but it always depends on the reimbursement conditions and, for example, non-prescription medicines, lotions, dressings, eye drops, dental care, etc. They're usually not reimbursed. So she did a calculation from travels, treatments, outpatient consultations, and different forms of treatment, and it's a big number on the individual and burdens very greatly. On the topic of Kela, the Social Insurance Institution of Finland, here's for this year the reimbursement for medicine expenses, and it's so small, please don't read it, but just as an example, I'm already jumping to the case examples from Finland. So basically the current annual maximum annual limit on medicine expenses is a bit over 590 this year, so it's going to be raised to a bit more than 620 euros next year. And here the Finnish Federation for Social Affairs and Health and its network of patient and public health organizations, where we're also a member, we've been working on towards a partition of expenses, like 600 euros. It might sound very small, but when it hits you at the beginning of the year, it's a very big amount for many on lower income. So we're trying to get a partition of expenses throughout the year instead of paying it in January or February at the pharmacy. So I would say that financial difficulties, they are indeed survivorship challenges, and there are the individual dreams, finding somehow the new normal, whatever it means on the individual case, and cancer has a substantial impact on income, job status, life circumstances, family relationship, fertility, rehabilitation, etc. And it would be very important to touch upon those individual needs and see how the cancer or treatments has affected the patient. But there's of course also the societal perspective, loss of productivity due to morbidity or disability pensions if people are not, for example, able to continue or cope at work. So what we need is a multidimensional and multi-professional cooperation to ensure a patient-centric and comprehensive approach, and with an individually assessment of one's life circumstances and needs. So this needs the collaboration of healthcare services, employers, employment services, insurance company, and so on. And the patient and the family should always be at the center of decision-making as an equal partner. But there's also a link between financial difficulties and medication adherence. It's the patient that has to live with potential side effects or late effects and take the medicine. So if you have financial difficulties, you might not be very motivated, or you don't have the money. You have to balance whether it's food or food for the pets or medicine this month. So it's very important. And also some of the European countries, there's already been right to be forgotten legislative frameworks, because there are also challenges with loans, mortgages, and insurance. So maybe I have a few more minutes. So I'm going to go over some advocacy case examples from Finland, and these are some of the things that I'll touch upon. So we did earlier this year, we did a cancer and work survey, and we got a very nice number of responses, almost 800. And I took a quote from related to the financial difficulties. You can read it on your own, but it shows all the thoughts that are going in the individual mind, like how am I going to cope at work, and what if I lose my job? What am I going to do then? How am I going to manage monetarily or otherwise? So they're very big concerns. And this is just some part part of the survey. And here are some examples of how to mitigate financial difficulties. And these are, of course, similar to the LuCE Report results. So many people use their own savings, borrow money, or use the one-time financial aid by the Cancer Society of Finland, and also as a last resort, receive social assistance that you can also partly cover medicine costs with. And there are many other issues in this regard as well. And maybe I'll just I'll mention that we also did a medication adherence survey, and the third biggest group of patients that responded were lung cancer patients. And I think this is really important because it's related to the financial issues. We found that 90% of the respondents were women with at least a bachelor's degree. So it might have, I don't know, we always get 90% of women. So if you know some tricks to get male responses as well, let me know. But anyway, the committed, almost everyone who responded were really committed to their medical treatment, but also concerning was that one in 10 either reduced the dosage or stopped the treatment altogether on their own, which is of course not good to do your own decisions. On the HTA, we're really involved in that, and we're really happy that we have the chance to be part of the hearing of patient organizations at the Ministry of Social Affairs and Health. And so far this year, we've done eight statements, official letters to the ministry, and here are some of the newest applications I picked that cover lung cancer. So we did a letter on entrectinib and sotorasib, and also just to show that these processes sometimes take way too long. So we did in August 2021, we did a statement on selpercatinib, and it took almost 2 years for a decision. That's way too long, and the patients really can't wait this. So it's as you can see with entrectinib, it might be long, but sometimes it takes longer. We have information for working age cancer survivors on a website for both patients and professionals coming in contact with them. We've done multidisciplinary collaboration with occupational healthcare services and healthcare doctors, and also including patient organization services in one brochure. And this also led to an article in the Journal of the Finnish Medical Society, Duodecim. And there's a brochure on benefits and services for working age cancer survivors so that they can, on time and based on their needs and challenges, find back to work and find all the right resources and services available to them. I'll skip this information kit for supervisors and the take-home message. So what we need is timely and needs-based actions to address financial difficulties. And these might also improve treatment outcomes, medication adherence, the individual situation to go better with cancer and their situation. And information is power. An informed patient has better access to resources and is more aware of patient and citizen rights. So here the role of Social Security and the national benefits and services come to play. And patient organizations also supplement public resources. And we have, as you know, we have a lot to offer. We have the time, we have information, we have real-world evidence out there. And cooperation is definitely a key. And this is what we're already doing here. And being involved in the national HTA process doesn't harm anyone. So I'm really motivated by that myself. So I encourage everyone else to get involved as well. But I've used my time. I thank you very much. Let's keep in touch. Please contact us or me if you have any issues. I'm happy to help. Merci beaucoup.
Thank you so much, Emma. It's great to see all of the activities that are going on in Finland, and you're absolutely right. It's about everyone coming together, collaborating and working together, because we can make a greater impact than when we do that. So it's my pleasure now to introduce our next speaker, Alexander Bruti. He is a retired Italo-French engineer based in Paris. He was diagnosed with lung cancer in 2020, and he has been active in the advocacy space since then, first with patients in Rizzo and more recently with Lung Cancer Europe. He also works with the Comprehensive Cancer Centre, the GHU Paris Centre, and Alexander will talk about the patient perspective of the financial impact of this disease.
Okay, so good morning, everyone. So it's so full of emotion. I take the speech now because effectively, since 4 years, so I was a full-time employee, and so was keen to work with people and so take the speech in public. But this is the first time I take the speech again in public. So I'm very honored to be here with you, and I take the opportunity to warmly thank the Parliament and also LuCE to give me the opportunity to voice the patient perspective on this so the specific topic, which is really sensitive, because you can see that cancer is not only a deadly threat, but it's often seen as a thief that spoils your life, and your well-being, which is so spiritual and also material. I'm sorry, I'm full of emotion, so don't shake me. I'm full of tears. This was not written in the speech. Okay, I'm here today to present my case, which will shed light on the report presented by LuCE and Anne-Marie just before. Let's see in a few slides what were the financial aspects from. You can pass the slides. Okay. Okay. And so I'm from Mon Réseau Cancer du Poumon in France, and LuCE. So I wanted, as I'm so former engineer, sorry, I put so a slide which give you in a diagram my so non-small cells lung cancer stage 4 case, what I call the pre, during, and post path of the illness. So you see with the diamonds the timeline, so which goes from year 0, where I was in full-time activities, so working maybe too hard, I don't know. But then came the cancer. So you see the man crawling into the PET scan and so IRM and whatever. And year 3, after cancer, what can you do with this after cancer? You have to retire, you have to go back to work, you have to go into invalidity mode. And then, let's say, hopefully, you can think when you are in year 5, which is not my case today, so to think about what is survival. Okay, remember, so as mentioned by the LuCE report, so 45% of the lung cancer are stage 4 directly, and so only 4% of them will survive after 5 years. So let's say it's really a sensitive topic. So in terms of revenue, I'm sorry to come back to because we are talking about financial incidence, work and revenue. You can see I took like battery level indicator. I think it's this electric world with cars and blah blah. So I think we have to think about us as a big battery, and we need to strain us, life strain us, and we need to reload. And but okay, in terms of work and revenue, you can see the curve is 100% when you are working. And then when you have the cancer, it depends, because I put 90% or 70%. It means that you have some revenue compensation, and it can go from 1 year to 3 years, but you will see that it's really different from one category to another. I'm just putting here my experience and my survey, but let's say I will take the opportunity to present you for other category of people. So then, after the 3 years, compensation stops. Sorry, and you have 3 ways. I told you 3 options: to retire, to go back to work, and to have invalidity. So for me, after 3 years, I was still dealing with treatment issues such as chemobrain and other neuropathic problems with the central nervous schemes, which were ill, and I could not work. So I had to go to retirement. But then, as you can see, you have a drop of 60% for myself in terms of revenue. So I'm now living with 40% of what I was earning 3 years and a half ago. In terms of health, you can see, effectively, when I was full activity, I was loaded 100%. And then with cancer, I was nearly critical, near to 0. And then, I'm now healing, and I hope that in years 5 I will be maybe not 100%, but 80% or 90%. And the same, the treatment you see, it's the burden of the treatment goes with not an optimum, I don't know, a maximum. Year 2. Just to speak, the burden is triple and is real. You have to balance finance, treatment, health with quality of life and family. I consider, even if I told you about my strain in terms of revenue, that I'm a privileged one, because I was diagnosed, as I told you, in 2020, and I was working in large international group since 22 years. It counts also to work for a long period, to get good compensation. But I was also having a salary, which is not the case for the freelance entrepreneur, where the compensation go really can be really shortened in small time frame. So you have to know that the executive status and contract led by private sector brings further mandatory clauses in terms of insurance contract. What we call in France health and provident insurance contract. These are mandatory for executive from private sector, but optional for all the other people. So it means that if you don't don't activate the option, then you have no other way to deal with. So this is really important, and this what I wanted to put here is to try to have an homogenization of this protocol for everyone. In my case, the Social Security paid the fixed amount per month during the long-term illness, and during this period, the Provident Insurance Company compensated my salary up to 85%. But then you can imagine the stressful situation when this stopped after three years. and you didn't. And on the other hand, you didn't regain your full health. So what I checked is I tried to give you the deviation for workers and category in France. What is strange is that you cannot find this data online. And I think I started to work with a comprehensive center, cancer center in Paris, and I asked to have a student to work on that. I hope I will have this a PhD in economics on health to work on that to give a global scenario for all the people. But let's say for what we see, you have year 1 to year 5. You see in yellow on the screen. And you see that the compensation is during sick leave is really dependent on the sector. For the private sector, it's also, which is representing 70% of the population, the executive and employee have up to 3 years, a kind of compensation. It's more important and so for the executives and for the employee. I'm sorry. In terms of public sector, which is representing 15% of the population, we have from 1 to 5 years, meaning that is bringing a lot of disparities. So why 1 in some cases and 5 in others? And for the freelance entrepreneur, it's max 3 years, but it's previous income. It means that people who were diagnosed like me in 2020 during COVID period. So imagine the burden because they didn't have work, so they didn't receive income. So who are there? So this one, just you can have this offline because I'm just explaining what you have when the compensation stops. Or you can go back at work, or you cannot go back at work because you are, depends if you are less than 62 years or more than 62 years old, which is strange because in France, we voted the pension to be taken at 65 or more, and in fact we have still a trigger at 62 years, so to see whether you can be incapacitated or if you have to be sent to retirement. Okay, what I tried because I had in advance the LuCE report and I was lucky. And I took the infographics and I said, okay, what are the infographics who are suiting to my case? And here are there. So as I told you, reduction of income, I'm part of the 62% who have a reduction of income. And as a second problem, so my income decreased higher than 40%. And so as 32% of the people who have seen their income decreasing. And I'm one of the 26.8% who had to retire due to illness. I'm in contact with social workers, 17.4. And why? I had something to say. Yes, yes, because I was not. Yeah, at the beginning I didn't discuss at all with the social worker because I was fine. I was compensated, and this was nice. But then after 3 years, so I saw really this coming, and I said, oh, I need to discuss with social worker. They exist, they are good, they can help you, but so we don't know that we can ask for help. Same for so the patient, but also for the caregivers. I never ask for the caregivers any solution and any help. Now it's late, but I know I could have done it before. So don't hesitate to ask the social workers. I never discussed the finance with the healthcare team, as I told you. Same, 70% of the people who have to deal with. And so I'm also part of the 37% who had to change their plan. For example, I still have two young adults at the university. The youngest continued studying the business school, but she had to ask, and she obtained, by the way, a discount for the tuition fee to the university dean, which is, let's say, good, but it's not charted, it's not in the contract. And the oldest had to postpone by 1 year his PhD courses. But at the end, so everything is good because he could go from Columbia to Oxford, and he has external partners who's paying for it. I didn't have also to pay for transportation. I didn't have to pay for drugs because everything was well covered in France. I can say that. So to the French health care is not perfect, but nearly perfect. So let's say this is in terms of healthcare what I had to deal with. I think yeah, you can have it offline. So then, what to say? I'm so 45 months after my D-Day, disease day. I could not rework after 3 years, and my cancer is stabilized, not in remission. After 3 years, I was sent to retirement. My revenue were shortened by 60%. The impact of contract termination, I lost of health and providence insurance contract coverage. So my wife and I are not as well covered as before. What in case of relapse? Because this is also the ultimate question here. I don't have any more disability or death and disposition because they are not covered by retirement rules. And in case of death, my wife will receive 50% of my retirement wage, which are 20% of my initial revenue. Just to tell you, because effectively, when you stop the insurance contract, you don't have you lose everything. You are not covered anymore. I think this was my last word. Thanks you for your listening.
So Alexander, thank you so much for sharing that. I know it is a really sensitive topic, and thank you for covering all of those things. And I think we can see that even in a country like France, where you've said, you know, that things are relatively okay, that there still is that financial impact for people dealing with lung cancer. So thank you so much for coming here today and for sharing your experience. We really appreciate it, and we understand how hard it must have been. Yeah. Thank you so much. So we will now have our third speaker, Lydia Gill. Lydia is a documentarist who works at the Catalan Institute of Classical Archaeology in Tarragona. She was a caregiver, and just this past summer, she became a member of the board of directors of the Spanish Association of People with Lung Cancer, also known as IACAP. And Lydia will talk about the caregiver perspective of the financial impact of lung cancer. So over to you, Lydia.
Hello, everybody. First of all, I would like to thank you for the invitation, the opportunity, and the honor of being here as a representative of the Spanish Association of People Affected by Lung Cancer to share my caregiver perspective of the financial impact of lung cancer. A year ago, I lost my mom to lung cancer, a fulminant cancer that took her in just 3 months. Receiving a diagnosis of end-stage lung cancer is terrible. It paralyzes and it mobilizes you and fills you with fear. Fear of losing this person. You don't know when. Fear of not knowing how to accompany her. And fear of not knowing how to take care of her and her last days. But also, seen with the perspective of time, receiving a diagnosis of this magnitude forces you to remember and feel the terrible inequalities that continue existing in this globalized world, in which not all people have the same rights or the same opportunities, including in the field of healthcare. But on the other hand, it also reminds you how privileged you are to have some economic savings to be able to take a plane as soon as possible and to be able to make a trip of more than 10,000 kilometers, because I am Mexican, but I have been living in Spain for many years. There are some studies that show that lung cancer is associated with the highest economic cost than other cancers, considering direct healthcare costs to healthcare systems, but also costs to the individuals affected, including lost earning and informal care. My story as a caregiver was short, but it was very intense because although it only lasted 3 months, the economic impact it has was an important issue. It is true that Mexico is an underdeveloped country with a healthcare system with many deficiencies, which is insufficient to cover its 130 million citizens, not only because it excludes an important part of the population, but also because it lacks adequate infrastructure, sufficient personnel, and sometimes also medicines. But it is also sad to see how some European countries share very similar problems, according to data collected at this LuCE Report, Financial Impact of Lung Cancer, a European Perspective. My mother was a teacher, retired, and had public social security. She lived in Guadalajara, Mexico's second largest city with more than 5 million citizens. And despite having been treated in one of the best private hospitals in the city, due to the collaboration agreements that the Mexican government has with these hospitals, we have to pay for many things to try to save time, because time in lung cancer can make a difference, a very big difference. For example, we have to pay for a biomarker study in a private laboratory to analyze the tumor, a resonance to rule out metastases in the brain, several X-rays with contrast, and many analytical tests. Faced with a diagnosis of terminal cancer, you don't not resign yourself and immediately go out to seek a second medical opinion with one of the best specialists in the city, if possible, in the hope that you can get a different opinion. One of the severe problems facing the Mexican system is a shortage of medicines. So in our case, we also have to pay for a session of immunotherapy plus chemotherapy, which was the recommended treatment for her, and which gave us the hope that she could live 2 years with a good quality of life. Palliative care is included in the Mexican public system, but linked to that shortage, all the pain patches, for example, we also have to buy them ourselves. But outside the traditional medical and healthcare system, people impacted by lung cancers need to be complemented with psycho-oncological care. And in our case, it was necessary to hire a thanatologist, that is a specialist in the accompaniment of death, who came home every week. And on the other hand, we also hired a nutrition specialist and bought a few food supplements with the hope she could be a little stronger and she could be a little better. Regarding expenses related to hospital stay, were associated with meals away from home, Ubers, or parking hours. And according to expenses we made to adapt home to the new needs, were renting a hospital bed and hiring a domestic worker. The medical recommendation was to carry oxygen 24 hours a day. And although we were provided with an oxygen concentrator, refills were paid for us. Despite this whole situation, I have to admit that I am very lucky and very fortunate person, because besides the love, attention, and all the support that many people gave us, I didn't have to worry about my work, because they gave me all the facilities to telework and adapt my working day to the 7-hour time difference. My study as a caregiver was short, but if it had been prolonged in time, it would also have implied the decision of whether or not to stay in Mexico, maybe requesting for a period of unpaid leave with the economic consequences that this entails. Until a year ago, I didn't know anything about lung cancer, mortality rates, treatments, causes, problems in sedation, etc., until lung cancer came home to take away one of the most important people in my life. But as I don't remember ever having read in depth on this topic, I didn't know of the existence of patient and family associations specific to each kind of cancer. I discovered ICAP in September 2022 in that desperate search to find answers to a lot of questions that had remained blank. I love the association philosophies by approaching lung cancer as a public health problem and from a diverse perspective: health, scientific, political, and social. But I also like it because of the services it offers, and I find all the work it does very commendable. Thus, it's why this summer I applied to become a member of its board of directors. In my opinion, the importance of not-profit associations such as ICAP lies in the fact that they help to improve the care of people affected by lung cancer. They are joining in the fight against the many inequalities that exist in public health systems, also in the European continent, and offer a wide portfolio of services which are sometimes not covered by healthcare systems, and they usually do it with very low fees, providing financial savings for family, among others. However, it is also a reality that many of these associations are underfunded and are based on volunteers, so some additional support from governments wouldn't go amiss. Finally, I would like to recall that the World Health Organization states that everyone should be able to exercise the right to health without discrimination on the grounds of race, age, ethnicity, or any other factor. And non-discrimination and equality requires states to take steps to redress any discriminatory law, practice, or policy. However, the data provided by reports such as financial impact of lung cancer at European perspective show us that we still have a long way to go, and that much political will is necessary. We need to, in order that the sum of efforts that are being made in different areas can materialize and help improve the quality of life of people affected by all cancer. But we also need a real commitment from the political sphere in order our people around the world can have access to quality healthcare services without being exposed to financial difficulties. Va por ti, mamá. Te echo mucho de menos. Thank you very much.
Um, it is just so difficult, and sometimes there just aren't words. And Lydia, thank you so much for coming here and sharing your story with us. And we are just so sorry about your mum. And we really appreciate you being here today. And we can understand how difficult that is. So thank you so much. In the interests of time, we aren't going to do questions and answers. We will be available a little bit, outside, and as we're exiting the building, as we're exiting the building as well, for some questions. So what I will do is try to give a very brief summary and our call to action. And I think really the summary is that financial toxicity in this disease is real. It has a real world impact on everyone, whether it's someone living with the disease, someone in a caregiving capacity. That whole family unit and extended family unit are impacted. And it's not just the day-to-day living, but it's also the day-to-day dealing with this disease. When people forgo, delay treatment, or have to make really, really difficult decisions about what they're going to do, given their reduction in income and how they have to survive and live each day with this disease. So we really, really all need to come together and work together to try and address this as best as we can, because obviously equity is something that is coming up so much as well. So whatever we do, we need to ensure there's equity there as well. So really the call to action from this report is quite simple, but I know it's going to be somewhat difficult to translate. It's just make sure there's a screen for financial toxicity and provide programs to assist with the costs of this disease if any financial vulnerability is detected. It's to work to increase income replacement program coverage for people unable to work because of lung cancer or caregiving. And we all really need to come together and work together and reach to achieve this call to action. So before I close out this meeting, we are going to have Shine a Light on Lung Cancer. So Shine a Light on Lung Cancer is an event from the GoTo Foundation for Lung Cancer. It's a part of their November activities, and obviously November is Lung Cancer Awareness Month. So you'll see there are some people wearing the white ribbons for lung cancer. And really this event was created to educate, connect and celebrate the lung cancer community while raising awareness locally and globally. And you may have seen that you have kind of like a little torch flashlight beside you. So what we are going to do, we are going to dim the lights or put the lights off if that's possible. If there's someone who could do that, hopefully it's possible. Thank you so much. Hopefully we can maybe. Perfect. So this may be as dim as it can go, is it? Possibly. So what I'll ask you to do is to grab your lights, but not yet turn them on. For all of you that have now turned your lights on, but I'd ask you not to turn them on just yet. Now I understand it's not as dark in here as what we would like, but we're going to go with it. In this moment, I would ask all people living with lung cancer to please stand up and switch on their light. So if you'd like to stand up and switch on your light. If you are a caregiver, a loved one, or anyone impacted by this disease, or anyone advocating for people impacted by lung cancer, please stand up and share your light. So as we shine our lights, we remember those we have lost. We honor everyone who has been impacted by lung cancer in our community and across the world. Our lights are a symbol of the progress, support, and hope that is created when we come together. And as a Lung Cancer Europe family, a phrase that we have used often from Helen Keller even, is alone we can do so little, together we can do so much. And really working together, we can be the light in the darkness for people impacted by this disease. So thank you all so much for shining a light on lung cancer. So we do have to finish at 11, and I do want to give people a few minutes to be able to gather their things together, and we may have time for 1 or 2 pictures. So really, it's for me to bring this meeting to a close, to thank all of you for being here in person, to thank all of those who have joined us online. Special thanks to our MEP host, Mr. Uheli, and his assistants, Zoltan and Lilia, and all of his staff who's made it possible for us to be here today. A huge thanks to Marta and the European Respiratory Society and all of your colleagues for the amazing help and assistance you've given us to this event today. Thank you to those who have endorsed our event, ERS, ELF, EPF, and the MEP Lung Health Group. I'd like to thank the LuCE board for all the work that they've done in this, and all of the executive staff, such as Maeve, Alfonso, and the others who aren't able to be here. I'd give a particular thank you to Diego for all of the time and effort that he has put into this report, and to everyone who was part of our working group. Thank you for all your time and effort, and really for all of those who disseminated the survey, who participated in the survey, who helped and supported in any way with this survey. A huge, huge thank you on behalf of the Lung Cancer Europe team. And with that, the full report is now available on our website, so please do give it a read. And thank you so much for being here today.